Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. So today we have a group of medical students with us, Kaitlynn Esemaya, Anamaria Ancheta, Annique McLune. They are all co-authors of the Kevin MD article, Why Vaccine Access Still Fails America's Most Vulnerable Groups. Everyone, welcome to the show.
Thank
Thank
you.
you for having us.
All right, so Kaitlynn, tell us about this article for those who didn't get a chance to read it.
So, this article is just one of many that we've created over the past 2 years. So, this article in particular was chosen mainly to raise awareness of vaccination hesitancy within the nation, as well as the real-time consequences that we are seeing when it comes to the increase of rates of individuals being diagnosed with these viruses at a rapid rate. So, this article in particular focused on the disparities within immunizations when it comes to minority groups and possible factors and barriers that are implicated when it comes to the under immunization rates. It also addresses some possible aspects that we as healthcare providers can do in ways to improve these vaccination rates.
All right. And obviously, as you all know, vaccine hesitancy has been a huge issue, especially with some of the more recent news and the interaction between vaccines and the current administration. So, Kaitlynn, tell us some numbers that we're talking about just to give us a scope and context for our discussion.
Mhm. So, as of March, there were about 301 cases of measles confirmed in over 15 states. Since March, that number has already grown. I'm unable to have the particular number at the moment, but these preventable diseases are on the rise within the United States, and vaccination hesitancy and the decrease of vaccination education is also increasing as well. So I do think that we play an active role right now in trying to decrease those numbers of people who are unvaccinated and give proper education, as well as factoring in possible barriers and why people aren't getting vaccinated and just trying to get to the root cause and understanding the individual's decision and why not to.
Anna Maria, the article talks about the various social determinants of health that sometimes drive the disparities between vaccination rates between certain groups. So, talk more about that intersection.
Of course, specifically here in New Mexico, where our medical school is located, we've seen a big rise in just access to the vaccines. Most of our patients that live in our near counties live in very rural areas. So having access to physicians that have even more, just more time to spend with different patients and their parents or their guardians to talk about why they may be having vaccine hesitancy. Some of the workarounds the New Mexico Department of Health have done have been to offer vaccines near, during, after the times of schools, so to allow children to go immediately from school to get the vaccine. And so we've seen that that has caused an increased uptake in the vaccine, at least in our area. In terms of also just having access to pay for the vaccine, a lot of folks have expressed hesitancy in terms of cost and coverage. And so we always like to remind our patients in our area that this cost usually is covered by their insurance, but also through the public health department that is with us.
Anna Maria, from your experience, which vaccines in particular are we talking about? Is there any one vaccine that people are more hesitant to get or for clinicians to give when you talk about vaccines in general?
Here in New Mexico, we have seen that vaccination rates prior to kindergarten age have been taken up more widely. The MMR vaccine, unfortunately, was just a vaccine that a lot of folks were expressing hesitancies towards. So we've been trying to do work with local medical societies to raise awareness for the community members and the physicians to be equipped with the knowledge that they need to discuss the MMR vaccine with their patients.
Annick, when you're co-writing this article, what are some of the reasons why people may be hesitant to receive some of these vaccines?
I think for the most part, it stems from like education and just not having access to some of the the drawbacks of why not getting the vaccine matters. And so particularly when we're, coming up with ideas of how to disseminate this information with our medical ethics newsletter on campus, we always think about what we see in clinics too, and just how we have to educate our patients about why it's important to take these vaccines, because sometimes they find that they just don't know, and you can't if you don't know, you can't learn. And so we always have to go back to why just education in general matters the most.
And Annique, when you said that people need more education on the vaccines, are you talking about the fact that these vaccines exist, or is there specific misconceptions or misperceptions about the vaccines themselves that they need educated about?
So the vaccine exists and what the vaccine does. I think particularly on a couple of my rotations, I've seen when, especially for the HPV vaccine, people just don't know what it is and what it protects against. And so sometimes it's just a bare minimum of just what it is and what it's used to protect against, I think is where some of that disconnect lies.
Give us an example. So, what are some of the specific questions that you're hearing from patients during your rotations, let's say about the HPV vaccines? What would a typical interaction be like from a patient who has questions about that?
So typically when, we go into a patient's room and we're talking about like a general well woman exam and we're, okay, have you ever done a pap smear? Have you ever been vaccinated against HPV? They're like, what is HPV? And then we're like, well, this is a virus that puts you at increased risk or with certain strain to get cervical cancer. And then we have to go into why it's important that you can get your pap smear. Doing your pap smear is very important, but getting the vaccine is protective up to age 45 and you can start as early as 9. So we go in, we tell them, and some of the times it's easier when, as a woman, you can say, well, I've also gotten this vaccine, or my sister has gotten this vaccine. And so you can kind of build that rapport as well to get them more understanding of that. It's something that's not going to really have detrimental impacts on their life if they get it, but that it's giving them some protection. And so we have to kind of make that rapport as well for it's because it's an intimate setting in the OBGYN office. So we're kind of building that rapport when you express that you also have received that vaccine.
Kaitlynn, when you spoke, you talked about the rising rates of measles, right? And now we're having hesitancy with the MMR vaccine, which traditionally has been almost universal uptake. Tell us about some of the stories that you're hearing specific to the MMR vaccine, because in contrast to the HPV vaccine, which is relatively more recent, the MMR vaccine has been much more established and has a much wider uptake. Are you seeing or reading about more hesitancy for people who are questioning something as established as the MMR vaccine?
Yes, I'm definitely reading. I'm definitely experiencing a lot of hesitancy when it comes to the MMR vaccine, as well as a multitude of other vaccines. And it's not just with the patients, it's also with other healthcare providers as well, whether it be nurses, medical assistants, other physicians, medical students. And I think it also just stems from a mixture of distrust within the healthcare system as well as possible distrust in the pharmaceutical system as well.
And Kayla, you said medical students, so you're experiencing some medical students who are also questioning the safety and efficacy of vaccines?
Yes, and I think it's honestly the rise of vaccine misinformation and pseudoscience. Right now, I believe that there is definitely a huge push going towards just going to use natural uses of medications, whether it may be, or treatments, and trying to stray away from pharmaceutical uses to heal the individual. But I think it's very important to understand like why we even came up with vaccinations and why they're important and why we need them. And it's not just because of our own safety and our own health, it's also to help many around us who are unable to get these vaccinations because they may have an immunodeficiency disorder or they may have extreme reactions that makes them unable to obtain these vaccinations. We are getting these vaccines to help those other people as well.
So, Kayla, what are those conversations like? So, if you have one of your fellow medical students who are questioning the efficacy and safety of vaccines, do, do you guys have debates? Do you try to convince them? Like, how do these conversations go if you have even fellow medical students who presumably have a strong basis in science, which is, they got into medical school in the first place. Where do these conversations lead to?
So they do always have a debate essence behind them, but we also come to an understanding. Obviously, we are able to understand the medical background about things. We're able to understand the science background about everything. And I think honestly, their misunderstanding comes from more of a subjective standpoint rather than objectively. They kind of come at it from, oh, well, I never get sick. I don't do my influenza vaccine, or I'm just doing the influenza vaccine just because I have to have a check mark on my vaccination list to be able to complete the year. And it's not necessarily that their argument is wrong. I do understand that their argument is valid, and I understand that everybody else's argument is valid. But I do feel like they are missing key parts within their argument by saying that they are not going to get this vaccination because X, Y, and Z. I think that that was the main reason why I even started the medical ethics newsletter is because there were these gaps in understanding when it comes to understanding medical injustice or health disparities within the minority groups, which lead to these disparities in immunization.
Anamaria, tell us about a path forward. We are living in a highly politically charged time where science is being attacked by the current administration, and trust in our healthcare authorities are at an all-time low. So, what are some paths forward in terms of how we can stem that tide?
I believe it truly deepens down at its core to building rapport with your patients. If you have that extra 5 to 10 minutes to spend with your patients and discuss with them their concerns and really talk to them and try to unveil what it is that they're hesitant about. A lot of folks that we haven't encountered have continually reported back to the 1998 study about autism leading to vaccines. And so really trying to dispel that information and talk to them and say, this study was disproven, that physician no longer has their medical license. It really kind of makes them take a step back and reevaluate their information that they are receiving. We, as medical students, have a unique role that we are allowed to have that extra time with those physicians and those patients so we can have that extra time that maybe physicians don't have. I think the best thing that we can do is continue to have different town halls, different communication methods, and much like our own medical ethics newsletter, try to dispel the information as trusted messengers.
Anna Maria, have you seen a success story or read about a success story where sometimes these conversations can lead someone, it could be a patient, colleague, clinician. Have you ever seen someone change their mind about vaccines because of the rapport that you're talking about?
Yeah, 100%. So during the COVID-19 pandemic, I was working on a study here in San Diego about the COVID-19 vaccine. And so we were working in communities where they had the highest rates of COVID-19. And so what we started to do was have discussions about the COVID-19 vaccine and what it meant for patients. And so a physician was leading a discussion on it. And one of the parents came up to me and said, I'm just here to listen. I'm not really sure. I never wanted the COVID-19 vaccine, but I'm here with my child because I want to learn. And after the event, they came up to the physician and I and shared how wonderful that we gave the information to them. No one has spent the time to discuss with them what the COVID-19 adverse effects could be and what it meant to protect not only themselves, but their grandparents at home. And so, because of that, they were willing to uptake the vaccine and got their vaccination a week later. And so, I really do believe that it comes down to just hearing people and what their concerns are and trying to give them the information so that they can make their autonomy choice to get the vaccine.
Annick, I mentioned earlier about medical mistrust and that trust in our public health authorities are at an all-time low. Sometimes medical mistrust among certain racial demographics are more prevalent than others. So how can we overcome some of this medical mistrust, especially among underserved communities who may have had poor experiences with the healthcare system? How can we in the healthcare field, how we can overcome that history of mistrust?
So I think the most important part is to acknowledge that it happened. I know we can't go back and change things that happened in the past, but we have to acknowledge that it's happening and it continues to perpetuate the system because that's just how it was set up. But I think having like culturally competent care is really important because we're meeting people where they're at, we're expressing information and we're building trust with them by meeting them where they're at and learning about, what sort of hesitancy they may have and addressing it and being like, well, cautiously addressing it and trying to shift them to the other side if they can get there. But if they can't, we also must not, kind of demonize them for their thoughts and their actions because it's a real injustice that continues to happen in our society. So I think we're meeting people where they're at and we're going slowly and surely towards making them, on the other side of it where we have a good culturally competent care that is, being that we can use for everyone and not have anyone feel ostracized because of their thoughts or actions.
So for those who aren't familiar with the term culturally competent care, Annick, what does that mean to you?
For me, culturally competent care is understanding that, everyone is different and they exist in their own different culture. Whether it's for me, I was born in Jamaica, so my culture of like medicine and herbal medicines and stuff was, is in my thought practice as I'm a physician, because I understand that other people come in with their own ideas of what health and medicine might mean to them, understanding that, they have their thoughts and I have my thoughts, and we're going to meet in the middle. And I'm going to be humble enough to understand that I can never live in their experience of their culture, but I understand that it impacts their health and impacts their livelihood. And so I'm going to meet them where they're at. We're going to come up with a plan and action to make sure that we're giving them the care that matches what they expect and what science also expects, or medicine in general expects.
We're talking to three medical students, Kaitlynn Esemaya, Anamaria Ancheta, Annique McLune, their Kevin MD article that they co-wrote, Why Vaccine Access Still Fails America's Most Vulnerable Groups. Now I'm going to ask each of you just to share some take-home messages that you want to leave with the Kevin MD audience. Kaitlynn, why don't we start with you?
I think one thing that I want to leave with the audience is that we all have biases, whether they be conscious or unconscious. And that is okay that we have these biases, but I think it is crucial that we acknowledge that we do have these biases and make sure that they do not interfere with the way that we treat others, because that is when it becomes a problem. It is okay to have them, but once it interferes how we view others and how we treat them, that is when it becomes detrimental to everybody around us.
Anamaria, your take-home messages.
I think I want to encourage healthcare professionals to be advocates within their community, not just within the clinic, but outside. Vaccine hesitancy begins before patients come into the clinic. So get involved with your local medical societies, learn what your local departments of health are doing, and try to be in the community and dispel information by being that trusted messenger that you are.
And Annique, finally, your take-home messages that you want to leave.
I think I want us all as healthcare and future healthcare providers to be culturally humble, to understand that everyone has their own lived experience. And because of that, we have to meet people where they are and making them feel understood and willing to participate as we take this journey as both a patient and physician to get their overall well-being under control, or to improve their overall well-being.
Everyone, thank you so much for sharing your perspectives and insights, and thanks again for coming on the show.
Thank you.